Ashley's going to walk into my first aid room, and she's going to tell me that her coveralls, her ratty coveralls, got caught in the conveyor, and it reefed on her arm, and now her elbow really, really hurts. Okay? So this is going to be a joint one. The other one we need to do. So, what happened, Ashley?
My coveralls got caught in the conveyor belt and holding on my arm.
Okay. You didn't hurt your back or your neck. You didn't hurt yourself anywhere else. Okay, you didn't fall down when this happened. Okay. Did they shut off the conveyor? Is there any dangers there? So, okay, good. Have a seat here for me, please. Okay, we're just going to slip this under your arm here, just like this. Just keep it covered. Perfect. Okay, her airway's open. Okay, so we're going to check breathing rate. Okay, this is one where you really need to follow that sheet, because if you get out of sequence, you know what, you're screwed. Okay, breathing rate is 24. She's a little anxious. She's in a great deal of pain. Pulse on the uninjured is present. Skin color and temp is normal, warm, and dry. So I'm going to go down the arm. What am I looking for when I go down the arm?
Deformities.
And deadly bleeds. So her arm is very cold to the touch. Okay, I'm going to have a look at this. Uh-oh, we got a little bone protruding and it is bleeding. So look in your bag. You should have a ring pad in your bag, and you should have some gauze. So what I'm going to do is just tent it so that the bone is right inside here. Okay, can you put some pressure on that? Okay, good. Okay, so now I'm going to go down the arm. Her hand is white, just like her shirt. So I'm going to decide to take a pulse. Okay, her pulse is absent, so she has no pulse, all right? It's pale, it's cool. I am 2 hours away from medical aid, so what am I going to do right now?
Call him.
I'm going to call a physician and tell him I have a pale, cool, pulseless limb. I'm 2 hours away from anywhere. Advice, what would you like me to do? This is what he's going to tell you, okay? Grab your patient in a handshake. Put your fingers along her pulse. Grab above her injury and below the injury, okay? Gentle pull, okay, and bring it towards 90, and when you feel a pulse, stop. Okay, we get a pulse there. You come here, please, for me, Curtis.
I imagine there'd be some screaming involved.
Oh, probably. Okay, hold this.
What?
Hold this here and hold it up here. And make sure you can feel the pulse there. Okay? You grab her in a handshake. Okay, like that. Put your fingers, can you put your fingers up? Okay, just, can you feel a pulse? Okay, so I've fixed C. Now what's after C? What else am I going to fix?
Deadly bleeds.
D. So I don't need her to hang on to that. I'm just going to throw a nice loop tie on that. Okay, can you lift that arm a little bit? Okay, I want your knot on the inside of the arm. Move your hand, Ashley.
Okay.
All right. So blanket. I'm going to give you some oxygen here. It's going to make you feel better.
That loop tie is now prevents it from going back?
No, that loop tie is just for the bleed. He's
Okay.
hanging on to the arm. Okay, no smoking, oxygen in use. Okay. Now, what's my decision? Is she RTC? This is limb threatening.
Yep.
Okay, so it's RTC. So when am I going to fill out my patient assessment chart?
Later.
En
route.
route. Okay. If they're RTC, how long have I got?
15 minutes.
You know what? I'm just going to use this so you can watch. This is my helper. Here. Helper's holding. Okay, I'll make this the helper. You can go watch. All right. Okay, so I've got 15 minutes to get her splinted and get her out of here. That's how long. So you don't have a lot of time. Grab your splints. Measure. Okay, Ashley, can you put the other arm about the same angle as that one? Because it's not at 90. I can't make it 90, right? So here. We're going to camber. Use your phone. These phones are really short. You don't have much room to fold move it over.
You look tired, Justin.
No time. You look asleep, Justin.
Better not be.
It's just aging.
No,
Wrong?
love you, Justin.
Huh?
Just to keep his eyes open.
Okay, with my helper that's hanging on to that pulse, you're gonna lift your arm. Okay, and we're gonna put it right on there.
Is there like a designated line that you can position at?
Pardon me?
9.
No, you're gonna pull it towards 90, but you're gonna stop
No, like
wherever you find your pulse. That's where you stop.
Okay, no, like for the precision, like you know, I have to call.
Yeah.
Is there like a designated line now that you can call, or?
Any physician, call the emergency in a first aid or in a hospital or. Okay, so we're gonna put this in your hand here, and I'm gonna start up here. With your other hand, can you press like that for me? You guys, your wound has to be what? Accessible, right? So you're not gonna go over it. Leave your tails hanging out here.
Oh, you. Lucky bitch.
When's Father's Day?
20th.
Is it the 20th or is it
Yep.
this Sunday?
20th.
Are you sure?
Yeah, I googled it. I wouldn't miss it.
My dad would've got his present.
I think that's the tired talking.
He googled when Father's Day was.
Is that good?
I said,
It's definitely
I don't know.
Okay, I'm just gonna check here to make sure we still have a pulse. And we do.
Thanks, Kurt.
Did you use that one wrap for above and below the elbow?
Yeah, I just skipped the injury site.
Okay.
That's the same one.
And we're gonna get rid of this helper
She's
here.
using the second
We're gonna leave this there. And I'm just gonna leave your thumb out. I probably would remove your ring.
She did. She just did it all the way down past the elbow.
Ring case in there. Something like that. You can do it.
I'll just see.
You and your Blackberry phone.
Thanks. Okay, I'm gonna check the pulse again. Caps. It's probably gonna be slower than the other one. How you feeling? Good? Okay, just gonna take this off. You're gonna stand for me.
Why? Oh yeah. Okay, I see what that is.
Feel like a roller cop.
Okay, so I can't put this in a large arm sling because the large arm sling is only good for 90. So I can't do that. So we're gonna do a collar and cuff. Okay, collar.
Collar.
Okay, cuff. Let's see how good you guys' knots are. We're gonna do a clove hitch on her wrist here.
Sweet.
Clove hitch.
I
Yeah.
know that one.
Me
I
too.
hope so.
Did you tie a butterfly in there anywhere?
Just a good old clove hitch.
Yeah. So it doesn't get tight on itself.
What a safety.
Okay, then we're gonna put this one here.
Whoa.
Okay, do a couple wraps so it doesn't get loose. Tuck your tails in because I want it to be nice, neat, and tidy. Doesn't look like a mess.
Oh, you just tuck them in the.
Yeah, and I'm gonna use this one over here. Okay, and then you're gonna use 2 broad bandages for your transverse. One above the injury, one below the injury.
Is that how low you want it?
I'm going, I can't move it.
Oh.
Okay, that's where I found the pulse. If I move it even a half an inch, I'm gonna lose that pulse.
Right.
I can't move it. That's where I found the pulse, that's where it stays.
Okay.
Okay?
There.
Okay? So if I push on this, it's gonna move the angle. Again, you don't wanna do that. So,
That's who they,
upper,
I get
whoever it is, turn
Huh?
I need to get
I've got a ring fence, Steve. I know.
Yeah.
10 minutes.
Winners.
Yeah, you should do.
I know.
Winners or
But
Walmart?
it doesn't vibrate.
Here, what's that cheap?
So I use-
I got this one.
I'll try and stick battery in it.
$15. No way, serious.
I
Nice.
flew in the wrong way.
Yeah.
below
Yeah,
the
you-
injury.
That was that, like,
Let's-
this case shot down the
What am I
road.
gonna do en route?
Secondary,
They're nice,
secondary.
They're nice, but fine.
And reassess.
It's not like some guys who be like, yo, dude, nice flip flop, bro. Like they give a shit. To the street, bro.
Yeah.
Samples.
Yeah. ABCs are gonna be every,
10 minutes.
5 minutes.
5.
because they're RTC, right? Vitals are gonna be every
10.
10, okay? So no time, vitals, history, head to toe. Very, very modified head to toe. She's already splinted, right?